I think when we work in the healthcare industry, no matter what role you're in, you can be a health professional, you can be a designer, an engineer, no matter what role you're in the healthcare industry, I think we need to remember and to always remember to come back to is what drives our work, and that's humanity. My name's Mel. So I'm a user experience designer. I work as a manager in a management consulting firm called Nous Group, and I specialize in the design, digital, and data. And I work across multiple different sectors, but predominantly in education and health. Um, and my other hat is a PhD research candidate. And my research is focused on using design and technology to improve the communication between young people with chronic conditions and doctors and nurses in emergency medicine. In terms of turning points, I think there are two pivotal moments in my life and career that brought me to the path that I'm on now. I think the first one is really my own lived experience, and growing up as a person living with a disability, I spent a lot of time going in and out of the hospital, navigating the complexities of the healthcare system, and having a couple of near-death experiences, which came down to really patient advocacy, and mine and my family's voices were not heard, and that sort of led to a whole downstream impact of a couple of near-death experiences. And I think all of those experiences combined, the younger version of me made a bit of a promise to my future self, and I promised that one day I will come back into the healthcare industry, not as a patient, but as someone who can leverage my own lived experience to create opportunities that can give back to the place that ultimately gave me a second chance to live. And I just the second pivotal moment for me is in my education. I experienced multiple different challenges and barriers of and just unconscious bias and judgments coming from someone with a disability. And when people see someone with a physical disability, they automatically assume what you're capable of. And I remember when I first started studying at Torrens University Australia, when I enrolled in my Bachelor of Digital Media course, I asked the program director, do you think I'll be able to do this course? Because the course has a couple of hands-on and physical components, which I knew I wouldn't be able to do. And he essentially said to me, I don't see why not, because we are a design school after all. It is our job to solve problems. It's our job to innovate. And when things don't work the way they should, or the way they could, then we innovate. And I think so those two pivotal moments have really helped shape my career and what I do today. My childhood was less about rainbows and unicorns and balloons. It was more about having a diagnosis of a disability that changed the course of my life.
I think you are the epitome of someone sharing from the perspective of lived experience, and it's extraordinary. I don't think I've seen 300 people in a room so still, so quiet and so attentive. So thank you so much for that.
I think one of the most recent challenging and rewarding projects that I've worked on is improving the discharge processes for patients. And as we know, there's so many layers of complexities involved in hospital discharge processes, whether that's in the community or to residential aged care homes or to group homes. There's always so many different pathways in terms of how we help patients transition from hospitals back to their everyday lives. And I think one of the most challenging things about this as well is that every state and territory has different processes, different policies and workflows. Even though we're sort of, as a nation, we're working toward the same agenda, there's still that different policies and processes across the states that we need to consider. But at the same time, I think it's rewarding because we get to speak to so many different clinicians, health services, community service providers, GPs, primary care providers, specialists. So being able to speak with so many different health professionals with diverse backgrounds across the country has been really, I think it has been both challenging and rewarding at the same time. And knowing that despite the different policies and processes and priorities across the states, we're still working towards a common goal as a nation, and that is to improve patient experience and achieve better health outcomes. I think in the recent years, the word I think co-design gets thrown around quite a lot, and a patient experience, a patient voice is such a central piece of the work that we do in the healthcare industry, no matter what role we're in. As long as you're in the healthcare industry, I think the patient voices and unique perspectives are central. So I think there's a lot of initiatives or intentions and projects that focus on co-design and bringing people along the journey with us and people with experience, but also how do we meaningfully engage with people with experience to shape our policies, services, and products. That's one. And I think the other trend is from a research lens. Now I guess talking from a research, putting my researcher hat on, I think there's a more increasing trend to be able to help researchers have a clear pathway of how can we accelerate meaningful research, bring people along the journey with us, but also have a pathway to commercialization or translating our academic research learnings into industry practice. But more importantly, how can we better collaborate research and industry and create a more of a strategic partnership to make sure that the impact of the research is directly related and translated to industry practice. One word, humanity. I think when we work in the healthcare industry, no matter what role you're in, you can be a health professional, you can be a designer, an engineer, no matter what role you're in the healthcare industry, I think we need to remember and to always remember to come back to is what drives our work, and that's humanity. And remembering that behind every statistic that you see in healthcare is tied to a story, and that story is tied to a person. And that person, and collectively as a community, what that's what brings us together in the healthcare industry. And I think as long as you never lose sight of the why, of why you entered into the healthcare industry in the first place, and remembering that at the end of, on the other side of the healthcare industry, it's humanity that's driving what we do every day, whether that's patient experience, patient voices, lived experience, that can and should be at the core of what you do and the forefront of innovation in health. Where does my passion come from? It comes from meeting people across sectors, across industries, but in health, it's about meeting individuals with diverse expertise, but also unique lived experiences that, and I think hearing and meeting, like hearing all the different stories and the lived experience and some of the challenges and opportunities that can come out of our lived experience, I think that's what I'm passionate about. But I think on top of all of that, it's really the fact that our own lived experience can serve as a powerful driver to enable innovation. Outside of work, I love to read. I'm a massive book fan. Those who know me will know that if you're ever in a rush, you never let me into a bookstore because I could spend all day there. Other than that, I think traveling and spending some precious time with my family, my friends, and people who I love.